After fighting to see an oncologist for almost 3 months, an Edmonton man died of cancer without ever getting an appointment. One Alberta doctor says it was a situation years in the making. Chelan Skulski reports.
Yeah.
You okay?
Yeah, I'm okay.
A question from Cece Nguyen's 10-year-old son that is difficult to answer after her family's life was forever changed.
I will never forget it for the rest of my life, that day. It's like if you could explain to somebody that their life has imploded.
That day, her husband, 41-year-old Stephen Wong, was diagnosed with stage 4 gastric cancer, the start of an 11-week battle for care.
We did not see a medical oncologist. We didn't speak to a medical oncologist, not even once.
Wong died in mid-July, leaving 3 young boys without a father and a family with no faith in Alberta's healthcare system.
If you could turn back time, I wouldn't have stayed here. The day that he got diagnosed, May 2nd, I would have hopped on a plane with him and left.
It really is heartbreaking. I think, to be fair and to be honest, this is a problem that has been in the making for years.
Alberta Medical Association President of Medical Oncology, Dr. John Walker, says with more complex patients and surging caseloads, cancer care in Alberta has reached a critical point.
It really is a crisis. It's a situation that needs to be addressed and needs to be addressed quickly.
An internal Cancer Care Alberta report presented to AHS last May found the number of new cancer referrals grew by 18% between 2018 and 2023. It also reveals the number of patients seen outside the Alberta Health 4-week target jumped by nearly 70% over the last 5 years. Wait times are also up. 5 years ago, patients waited an average of 6.3 weeks for their first consult. In the first quarter of this year, that number was 10.3.
We're really in a deficit right now.
A spokesperson for Alberta Health Services says they are considering improving access by extending clinic hours and says 17 new doctors were hired in the last year. The AMA says more than half of those doctors are to replace oncologists retired or moving away, words that offer little closure for this wife turned widow.
I banked on a system to help him, and they ultimately failed him. And I have to live with that for the rest of my life.
Chelan Skulski, CTV News, Edmonton.